Pretty much some of the biggest mistakes that I personally feel like I made during my clinicals and how I would do things differently if I was going back through nursing school. And welcome back. For those of you who are new here, my name is D'Amber. I'm 29 years old and I have been a registered nurse for almost 4 years now. I have experience in the PACU, medical oncology, med surg, what else? Travel nursing, strike nursing, hospice, and I believe that is all. I just want to say thank you guys so much for all of your engagements, your likes, your comments. Make sure you guys subscribe, follow, share, comment, and continue to stay engaged. So today's video is just pretty much some of the biggest mistakes that I personally feel like I made during my clinicals and how I would do things differently if I was going back through nursing school. Even though I was a tech before I became a nursing student, I was very well familiar with the flow of patient care and how to handle things as a PCT. But those things just give you confidence with, you know, knowing how to give bed baths, knowing how to take vitals, knowing how to talk to people. But it doesn't give you the confidence of knowing how to be a nurse. Because with the nurse, it comes with so many different more tasks and you have to actually critically think about things in the situation as they're going on. So with that being said, let's get into it. I think my biggest mistake was one, acting like I knew it all. Like I said, I had the experience with being a tech, so I knew how to properly, you know, take care of a patient, walk them to the bathroom, help them brush their teeth, help them get dressed, help do bed baths, help turn the patients and change linen, all that stuff. That was bread and butter for me. But the feeling like I know it all when it came to the nursing clinical side was the part that I feel like I would take back. So when I say acting like I knew everything, not necessarily in the way that you guys would probably think, but more so like when you're giving a report and somebody is telling you something and you have no idea what it is, or you finally see one of those crazy weird diseases that you've heard about, but you don't remember it. And you're always like, oh, what is that? And you and the nurse can go back and forth and report and try to figure it out. That I didn't do in nursing school. Instead, I would just sit there and act like I knew exactly what they were talking about and I had no idea a majority of the time. I'll give you guys even an example outside of clinical so it makes a little bit more sense. But when I was going to pediatrics from my first med-surg adult job, they used to use all types of lingo that I had no idea what they were talking about. They'll be like, yeah, this patient came in with a BBFF. And I'm like, what is a BBFF? Or the orthopedic surgeon will call and be like, hey, can you check on this patient? They have a BB, broken bone, but both bone forearm fracture. And I'm like, what is that? And then somebody be like, that's a BBFF. And I'm like, okay, this is too much. Like, so I feel like I acted like I knew everything in that aspect when I could have just simply asked those questions to honestly help me understand more. And it would actually help your studying because you'll read a book, you'll see people on videos, you'll, you know, go through all your nursing school, and some of the stuff that they talk about in the clinical settings and some of the language they use, it will come across while you're studying. So don't go in there acting like you know it all. If you don't understand a lingo, if you don't understand language, if you don't understand something that they're saying, a procedure or anything, do not be afraid to ask them like, hey, what is this? What is the process? Can the patient eat before? How long does it take? All those things. Because I will tell you, most procedures and most diagnostic testing is the same at every facility that you go to. Another thing that I used to do a lot in clinical was like stand around and wait. One, because being a PCT, you understand, or a CNA, however you want to call it, you understand like how nurses feel when nursing students come to the unit because you hear it at your job. So a lot of the time, sometimes I would sit around and wait, or I would allow my classmates to get the experience because I felt like I had already had a majority of that experience from watching the nurses do it when I was a tech. I probably should have been a little bit more hands-on and, you know, learning the skills that I didn't know how to do, like putting in NG tubes and real people, because you got to realize when you're in clinicals, your clinical floor may not be similar to the floor that you work on. So that floor may even show or do a lot of different things compared to the floor that you're used to working on. So yes, don't stand around, get involved. If a nurse is getting ready to do something, just say, hey, you know, can I join? The nurse will be like, yeah or no. Or, you know, just say, hey, do you think this patient will care if I come watch you? Most of the time the nurses will say, yeah, if a nurse doesn't want a nursing student, you will literally know before the shift even starts. So yeah, don't just stand around. Get in there, learn, ask the nurse questions, ask the patient questions. You know, you can literally learn so much during clinicals. Another thing that nursing students love to do, and I feel like I did, was honestly just, you know, focus specifically on skills. Like, yes, the IVs are fun, the NGs, the Foleys, stuff that you've never seen before, Pleurics, drains, all those things are fun to do. But as a nurse, you also have to understand that it's more than just doing skills. You have to learn how to prioritize care. You have to learn how to discharge people, admit people. What else do we do? We do so much, and look at me drawing a blank. You also have to learn how to just educate them on whatever procedure they have. If you get a patient back who has a T-band, you gotta understand and talk to the patient about what you're gonna do. I'm gonna be in here, you know, so often releasing air from this. So it's more than just about doing skills. It's about, like I said, prioritizing your care and making sure that you have your day planned out and that you're able to keep people safe and get done what needs to be done and, you know, go home. So yeah, that's another thing that you could do during clinicals. And when you come to clinicals and if you forget things, that is totally fine. I remember I used to have a clinical instructor that would literally question me over every drug before I gave it, why I would give it, and then have me go over vitals and labs before I would give a medication. And I would literally be so scared every single time we did it because I'm like, this is a lot of pressure. Sometimes you never even seen half of these drugs because you just learned them 2 minutes ago in pharmacology class, and now your clinical instructor is questioning you about it. That is literally okay. You're there to make mistakes, but you're there to also brush up on things that you've seen but don't remember. But honestly, your biggest way, let me say your biggest way. In my opinion, the biggest way to learn is by your mistakes. I have made plethora of mistakes and I've learned from every last one. Listen, I'll tell you guys, one time I gave a patient that was on Lasix for, you know, diabetic reasons or whatever. Her blood pressure was already in the 90s and I still administered the Lasix, and I literally thought that I bottomed this lady out. I was freaking out. She ended up being totally fine, but like, those are things that you just, you know, once you make that mistake, you'll never make that mistake again. So don't be afraid to make mistakes, because you may make your medical mistakes. You may use drains wrong. You may do all types of stuff. Don't be afraid to make mistakes, but also don't be afraid to ask questions if you truly have no idea what you're doing, because sometimes those mistakes can be fatal. So if you truly are unaware, have no idea, unconfident, ask. But like I said, it's okay to not know everything, and it's okay to make your mistakes, because your mistakes is how you learn at the same time. And when you go to clinicals, don't compare yourself to others. Like I've talked about comparing yourself to others a lot in just all my other videos, but clinical settings, a lot of people like to compare themselves to others too. Like, oh, my patient, you know, is doing this, and the third, or I got the IV on the first time, or I didn't get the IV, I got the vein, but it blew, or, you know, dang it, the NG, whatever. Listen, it won't be the first time you miss an IV. It won't be the last time you get an IV. Just don't go in there comparing yourself. You guys are all there to learn. You guys are all there to get experience and understand how to accurately work as nurses. Comparing yourself is literally the last thing you should be worried about, because even when you become a nurse, you're going to have your own flow, your own way of doing things. So sitting there comparing yourself with your classmates is literally pointless. And if you have access to the patient's chart, make sure you dive into the chart and look at that stuff. Look at their lab values, look at the doctor's notes, understand how to read the doctor's notes, because we have Cerner, but we're going to Epic, and I'm so excited. But either way it goes, both of them will have notes in their charts. And, you know, the beginning of their notes will always tell you why they're admitted and all that stuff. And honestly, I read the beginning of the notes and I scroll down to the bottom of the notes and read the plan. If I really need something, I'll dig into the middle part of the notes, but majority of the time, the middle part of the notes don't even have a lot of information. Every once in a while, you may get like a little random fact from the middle part of the notes, but literally the beginning of the notes and the end of the notes, most important. Learn how to look at lab values. Learn how to look at orders. Orders. Learn how to look at orders. Ask the nurse how to look at orders. Ask the nurse how, you know, just how to use the charting system. Because if you're going to stay in the state or the city or wherever that you are going to clinicals at, there's a good chance you're going to even see this charting system. So ask, can I play around with your computer? Like, just don't do anything crazy. Don't enter orders. Don't do stuff that, you know, it's okay to click and clack and figure things out and ask questions once again. But yeah, just look at orders. Like, learn how to read those orders while you're in nursing school. It'll literally help everything when you get to the real world. And lastly, don't let one bad clinical define everything that you have going on. I've had plenty of bad clinicals. I remember, I love to tell the story because I cried like a baby. But one day I was in a clinical setting and my patient was asleep and we were trying to give him, I believe, lactulose or potassium, something that was like something that needed to be sipped. This man would not wake up. So I was like, well, let me try. You know, I've had this experience before and the person I was working with had never worked in healthcare. So I'm like, maybe I can get him to wake up. Mind you, it's him, his 2 daughters, and his son in the room. Paint the picture. I'm like, hey, Mr. whatever. Hey, can you wake up? Can you wake up? Mind you, my instructor's in the room too. So she's just standing there, you know, watching us see how we interact. He finally wakes up and looks at me and says, what are you doing? I said, oh, wow. That was all that I could say because that was the first time I've ever experienced that in an actual work-like setting, and I had no idea what to say. And my instructor looked at me and like my classmate looked at me, and I was just devastated because I was like, wow, like. And I remember the whole class found out. Everybody was coming up to me, like, you know, just checking on me. And that honestly made me feel even worse because I was so embarrassed, like super embarrassed by it. And I definitely cried, but I got over it. And that kind of like, you know, woke me up to, okay, I see how this is going to go. But don't, you know, I could have at that moment been like, this is not for me, let me stop. But I kept going because, you know, people need me regardless of how one person may perceive me. And they don't even know me, to be honest. So it is what it is. You know, people will be mad at their situation and not really mad at you. So don't allow one bad clinical to define, you know, everything that you got going on. So lastly, if I could leave you with one piece of advice, it would be don't measure how successful your clinical day is based off of all the cool things that you got to do. If you got to go down to the OR, if you got to do IVs, push medications through the IVs, all of that. Some of the most boring clinical days have taught me lessons, and some of them I still use to this day. So don't just, you know, feel like you have to do something every clinical to be learning. That's not always true as well. So yes, those are some of the mistakes I made in clinical, some things that I would do differently, and just some clinical advice and all.